Hi there, Pioneers and Patriots. It's Katie Witt. On March 26th, our congressional campaign assembled Rocky Mountain leaders from healthcare, education, and industry for a virtual briefing to discuss America's health and economic response to the COVID-19 threat. The following features Congressman Bob BEAUPREZ as the moderator of the event, and we were joined by experts including Dr. Mark Olson, MD, Medical Chief of Staff at Lincoln Health, who discusses the health response and advances in telemedicine. TJ England of CR England Trucking talks about how shipping has been impacted by COVID-19. Brad BONHAM, CEO of Walker Edison, discusses the effects on manufacturing and e-commerce. Dan Haley, President and CEO of Colorado Oil and Gas Association, addresses all the challenges facing the energy sector and how they're equipped to bounce back quickly. CU Regent at Large HEIDI GANAHL discusses the massive changes in higher education. Bill Mitchell, President and CEO of the Bankers Bank of the West, gives us insight into how the private sector can be unleashed for the good of our region. As a mayor, I discuss the response from a government and a community point of view. In this crisis, following President Trump's lead, governments are embracing the free market, slashing regulations to allow the private sector to innovate, and promoting public-private partnerships. My hope is that this deregulation will provide long-term benefits to the economy, as well as furthering innovations like telemedicine. We hope you find this webinar informative and would love to have you join us for one of my virtual cottage meetings by Zoom coming up this month.
How have you managed the health concerns for your staff, their families, the general public during these crazy times? 4 or 5 weeks ago, we really wouldn't have imagined we could be here, but here we are. So let's have that discussion about just that. Dr. Olson, what's it like in your corner of the world, speaking of being at the tip of the spear you are?
Well, sure. As you can imagine, it's been a total game changer for all of us. We've been a little bit isolated from it out on the Eastern Plains, but we've had our first case reported yesterday, and we're prepared for that. We've gone from doing business as usual to kind of controlled mayhem. There have been guidelines that have been developed and changed at a frenetic pace, and we've been trying to keep up with all that. It's gone from social distancing to now a statewide mandate to stay home. We've gone from 2 weeks ago restricting visitors to a long-term care facility to now no visitors to the long-term care facility or the hospital. We have a 15-bed critical access hospital out here. We've gone from seeing patients, busy family practice, geriatrics, to kind of shunning patients away. They're not allowed to come to the clinic, and we're trying to develop telemedicine and telephone medicine, which we've been trying to do for the last 10 years, but it just has not been feasible financially. Fortunately, the state and federal governments have reduced the restrictions and regulations such that we can now get reimbursed reasonably. So hopefully that'll help us. The way we see patients has dramatically changed. So far, we've been able to get by without any layoffs, but we're a critical access hospital. Our margin is less than 1%, and you can't lose much volume or procedures and sustain business very long. Fortunately, in the first stimulus a couple of weeks ago, the federally qualified community health centers had their funding enhanced by that. And we're hoping that with the new legislation and legislation to come after that, that they'll look at the critical access hospitals and the cash flow issues that we're going to have. And they're looming. Our volumes have just tanked. And because of this, we're trying to think out of the box to try to work on that. Trying to put staff in different venues, perhaps doing home care, where staff will go to homes in protective gear and see patients that way, and then by telemedicine as well. But multiple different things we've been trying to think of to try to um, maintain volume and be able to deal with this. So far, we have not been hit heavily with any respiratory issues. As I said, it's in the community now, so testing and all that has been ramped up, although it's still behind. As far as how we're dealing with our personnel, we have strict policies and procedures on how we see patients and for exposure. Our protective equipment, we have an adequate supply right now of PPE, but that will rapidly deplete. And right now there's a nationwide shortage. We work through the county health office and the state to get that replenished, and multiple suppliers. As far as the community goes, we've been hosting Facebook town halls where we interact with community members and discuss and try to allay their fears, provide some structure and facts in what's coming up next and what they need to do. And that's been well received in the community so far. And right now, we're like everyone else. Everybody's a little bit unnerved, and it's just the uncertainty that everybody is facing that's really an issue. The good thing is that everybody, at least in my shop, are on board with the whole process and working diligently to try to stay ahead of this.
Thanks very much, Doctor. TJ, let me go to you next. And I think you think about the stuff that simply has to get done. I used to be in the dairy business. You heard Katie say that. And, every day you had to get up and get the cow's milk one way or the other. One thing we can't stop is all the materials, the goods that people like you make available to us. And, much of the country has shut down, but I know truckers keep rolling and somehow have to make it happen. What's it been like?
Yeah, we're in a fortunate industry, thankfully, during this type of crisis where our demand has skyrocketed. Our specific niche is refrigerated food service. So we actually food, beverage, pharmaceutical is kind of our largest segment. And so absolutely, we've seen huge demand as folks are heading to the grocery stores and they're increasing their own personal inventories of food and beverage and other things and medical supplies. That is just flowing straight through to demand for our trucks and our drivers. And, naturally, that's been a good thing for our business and for our employees as we've seen a lot of other industries have to let folks go. Our drivers and our non-driver staff are staying busy and able to actually take pride in making a big difference. But they too are facing some of the same concerns. In fact, we have moved more than 90% of our non-driver staff to work from home. Fortunately, we were about 50% of the way there when the earthquake happened, not very far from our headquarters here in Salt Lake. And so, it's been a wild ride to try to keep up with this intense demand while we're in the process of trying to move everybody home so that they can be with their families and social distance and all those things. And we're seeing some odd behavior as is well reported. Toilet paper has been a huge demand. Fortunately, Georgia Pacific is a customer of ours, and we're moving a lot of toilet paper products. So that's been good. But we've also seen, this is just an interesting anecdote, we've also seen interesting behavior, interesting is a generous way to put it, by some folks. When our trucks are making deliveries at grocery stores, we've actually had 3 instances where we've had to have police escort because folks have been there prepared to loot all of the product out of the trailers. So that's been that's been a bit of a wild time, and certainly not a boring time if you're in the legal compliance HR field, which I cover. It's been 24/7, around the clock. And as of this time, we're proud to say, we've got 8,000 employees nationwide, and we have yet to have one confirmed case among any of our employees, and we've got folks moving around all the time. And so it's been an exciting, wild time, and we're looking forward to getting through this process. But yeah, it's been actually something that we're very proud of. We've heard from a lot of our customers thanking us for the service we provided on behalf of their customers and folks out there in the industry. So it's been a good time for us.
Well, I'll add my thanks to that. I know how critical it is, and you guys kind of keep America moving. So I appreciate it.
Thank you so much.
Let me remind or mention to all those that are on this, listening in, the attendees, that this is going to be interactive. At the end, we'll have a Q&A period. So if you've got some questions, keep track of them, and we'll let you know when we're ready for that part of it. Down at the bottom of your screen, in fact, your screen is exactly like mine. You should have a Q&A button where you'll be able to voice your questions and pass them on. Dan Haley, I'd like to go to you. Boy, if anybody's been rocked, it's the oil and gas industry, and I don't mean just by the COVID virus. Lots of regulations thrown at you, trying to choke you off, and now Saudi Arabia and Russia are trying to flood the market and drive prices down. The last time you and I spoke, what was that, just last Friday? You'd said oil reached $19 a barrel. I can't even imagine. I mean, it wasn't that long ago when we were talking about oil being in triple digits a barrel.
Yeah.
$100 a barrel. And so I'm sure your industry is rocked. Speaking of critical industries, at least for the time being, so far as I can tell, we're still going to need a lot of oil and natural gas to make things work. So what's it like for your producers?
Yeah, well, absolutely. Thanks for having me on. I can tell you that today, America's oil and natural gas employees are working. They are out in the field across the country, across Colorado, delivering this essential product that we all need every single day. In Colorado, our employees are considered essential employees, and they're tending to critical infrastructure. So they are allowed to continue working out there. But these are difficult times, as Congressman BEAUPREZ noted. Not only are we dealing with coronavirus in this industry, which has decreased demand as fewer people travel, as they fly, as they don't commute to work. You're seeing that demand come down for oil and gas. But at the same time, you have Russia and Saudi Arabia who are in a price war with each other. They're flooding the market with product. So you've got that kind of what you learn in your high school economics, the supply and demand question. We are oversupplied with product and demand is decreasing. So it is a very bad combination. Oil this morning was $23 a barrel. Exactly 1 month ago, it was $50. As Congressman BEAUPREZ was referring to, in June of 2014, it was over $100. So you've seen a lot of that value leave. Make no mistake, separate from coronavirus, this is part of this price war is Russia trying to break the back of the shale revolution, which has changed our country, which has made our country more secure, more energy dependent. They want to see us go away through this process. They understand that we're dealing with this virus at home and making it very tough because the United States is now the #1 producer of oil and natural gas in the world. So we can't let that happen. And I think one of the lessons that we're seeing across the economy through this whole time of dealing with coronavirus is the need for that efficient and reliable domestic energy supply and just how important that is. So while this price fall has been dramatic, this is a resilient industry. We have been through times like this before, maybe not quite exactly like this with all these different things hitting us at one time, but we have been through these cycles before. Our energy workers have gotten very good at producing this essential product, a product that we all need every single day. And I mean, every single one of us needs this product in so many different ways throughout each of our days. We've gotten very good at producing this product at a lower cost. And so while we have faced serious challenges before as a country and as an industry, I'll tell you, and I know this probably sounds a little Pollyanna, but I would bet on the men and women in this industry, in this country, every single time.
Well, I think when we do turn around and start growing this economy again, I think oil and gas will play a very big role in it. Thanks for joining us today. Brad Bonham, I'd like to go to you next. You've been kind of on a vertical climb, growing a business rapidly and expanding your market and knocking it out of the park, not only as a furniture manufacturer, but taking advantage of the e-commerce market. What's happened to you in the last 4 or 5 weeks?
Yeah, it's really interesting. Certainly, we are cognizant of all the terrible things going on with coronavirus. For our business, though, having 300 million Americans locked in their home, working virtually, shopping virtually, where I am 100% e-commerce focused, we've actually seen a very large demand increase at this point. And so, we sell value-priced home furnishings across Walmart.com, Wayfair.com, Overstock.com, which is a local company to us in Utah. And so I feel like we've been really fortunate in that regard to have e-commerce exposure. I've gotten quite a few calls. I fielded a number of friendly competitors' calls at this point that had a great deal of exposure to brick and mortar. And I don't know if you guys have been to a mall lately, but I don't think you can even go to a mall right now. And
It's
so
not hard to find a parking spot.
it's yes, we see the positive in most of that stuff, right? But it's sad to me. We've got a lot of our commerce shut down right now, and for us, being online, having warehouses kind of across the United States, I think one of my biggest worries right now is simply, will UPS and FedEx continue to ship if Corona continues to kind of if there's a worker in any of those facilities, how do they react? Certainly, broadly from a macro perspective, we want the economy to continue cranking. That disposable income, that goes to all these different people to buy my product online. We want that to continue. So, hearing about millions and millions of Americans losing their job, I think that will drag just the broader economy down. And there will just be less money to spend.
What are you doing about the safety of your workers and their families? I don't know how confined you are in your manufacturing plant, but if you had to make any changes there?
We have a few million square feet across the country now of warehousing operations. The nice thing is most of these jobs are far more than 6 feet apart. They're driving forklifts, they're driving things like that. We have asked anyone, and this is a very frequent, we're fairly maniacal about this because we don't want anyone being exposed to unhealthy conditions, right? And so daily briefings with all of our employees, making sure those masks are on, making sure gloves are on, making sure things are sanitized. I mean, really trying to just go above and beyond like so many other businesses are trying to do right now to protect the health and safety of our employees. Additionally, we've bonused employees out for coming to work. We really trying to make it a safe and effective work environment while they're shipping product for us.
Good. Thank you, Brad. Mayor Witt, let me go to you. Future Congressman Witt, Congresswoman Witt.
We're going with Congress member
All
because
right,
it's like
all right. Whatever works for you.
Yeah.
Yeah, as I was mentioning to Dan, as if COVID-19 wasn't enough, you had other issues. You had an earthquake to deal with.
Right. Yeah.
I mean, what have you done wrong?
One wonders.
Talk about a bad double whammy. All kidding aside, and I shouldn't even be trying to make a bit of a joke about it. It's serious times. And as a mayor, you've got to keep essential services moving.
That's right.
Tell us how that's going, and I don't know how it's impacted revenue at the city. I'd be curious to know, especially about that part, what you've had to do with your I'm sure you've got a considerable staff, their safety, their health. How have things changed? And I know as mayor, you get a whole lot of the leadership responsibility and privilege with that job.
Yeah. So there are two things going on at the same time. Previous to my experience here in Kaysville, I had served on a city council in a community that experienced a devastating flood. So that was in 2013. And so this is not the first time I had to deal with a natural disaster, but the difference between what we're dealing with now with coronavirus and a natural disaster like a flood or an earthquake, the difference is this is a long thing rolling out, and we really don't know how long it's going to last. Whereas with your usual natural disasters, it happens in a short period of time. It could be minutes, it could be over several hours, but it is over with, and then it's all the cleaning up afterwards. With this, it is something that we had not planned on. Our emergency first responders had not put in our emergency operations plan pandemic. So we were kind of creating that as we go along. So it was the week of the 15th when we started taking things more aggressively. We decided that we needed to, number one, protect our staff. And so what we did is we closed our city buildings. You can still have all the services you need. You just need to set up an appointment. And so we did that. We canceled all the rec programs. We canceled the Easter egg hunt. And there was many sad tears that fell because of that. But so that's all that we've done to this point. All our services, your trash is going to get picked up, your power is going to work, you're going to get water, gas works. So that the job,
fire, police, fire, EMTs, all that. How about schools? Have they stayed open or closed?
No, schools have what we call a soft closure at this point, meaning that there are no classes in session, but if kids need to go in for food, they can go in. But that will change soon. I believe the governor just announced that we're extending the soft closure to May 1st, and many parents not too excited about that, as you might imagine. But I think that at this point, everybody's got a great attitude. Everybody's working really hard to, keep a good spirit about this. I was sad to hear about the gangs of toughs trying to attack trucks and loot the trucks. I hadn't heard that. Here in all throughout my district, I hear good stories about encouraging people and helping each other and that sort of thing, which is all very heartwarming. But we have a long way to go. It's one of the things that I'm a little bit concerned on, that we're make sure that we keep vigilant through however long this takes. So we're going to keep our people safe. Their police, fire, everybody's ready to help as needed. Our concern as a city is making sure that we keep our people and property safe, employees safe, and make sure that you can stay in your home safely.
Thanks, Katie. Bill, let me go to you. Bill Mitchell, CEO of Bankers Bank of the West. I know you've been through chaotic times before. We mentioned that at the top. Here you are again. Tell me, I can only imagine, having been a banker myself, as you know, you've got people that are struggling to make loan payments. So you're getting hit on that side. You probably got some people that are very nervous about having enough finances in their own budgets. So maybe deposits are running off too. You're trying to keep open and service the public, but you're worried about exposure to this virus for the sake of your staff and customers. What are you hearing? I guess personally, what are you doing at your office? But especially, what are your 220 community bank members? What are they telling you?
Well, and first off, Bob, I'm in my office downtown Denver. We've got about 25% of our staff working on site. We have the ability for the bank to be run completely remotely, should it come to that. As Dan mentioned, for oil and gas, banks are essential businesses, so our people can get to the office. But to protect our staff, we've really limited, how many can be on site. If anybody has a sniffle, we send them home for 14 days. So we've been very proactive to protect our folks. It's really important as a banker's bank that we stay available for community banks that rely on us on many different things. One of the biggest being liquidity. It's interesting is 10 years ago, it was August of 07. So I guess going on 13 years ago, first ripple effect. And then by maybe late summer and definitely by October of 08, we were feeling the impact. This time, 16 days ago, I was at a conference with 3,000 people, came back to the office 15 days ago, and we did start really ramping up business continuity. And then things very much hit rapidly, and it was pretty stunning when every sports canceled. And then I started to wonder, what in the heck was I going to do at night if there's no sports? But it's been extreme. I'm really proud of our industry. And a couple things I want to mention, kind of back to your questions. The payment system's working, and it will continue to work. Folks have the ability to get cash out of their checking accounts, ATMs, remote access to banks is available, whether it be through technology or drive-up windows at banks. Certainly all banks, to protect their staff, are working with skeleton crews, but they are functioning. And then debit and credit cards, the system's working, the payment system will continue to work moving forward. I've been real pleased with the bank regulatory agencies and that they're taking more of a partnership approach this time than maybe, I don't know if there's any regulators on this feed than maybe 12, 13 years ago. And what they've done, they've made it very clear they want financial services entities to work with small business, to work with consumers, whether it be deferrals. For example, here in Colorado, the state banking commissioner came right out and said, no deferral up to 90 days would ever be criticized by for state chartered banks. That's a very proactive stance that he took. And the national agencies are acting kind of the same way. They want to protect the consumer. They want to protect small businesses. The key is we got to get money out to these folks. I mean, it's got to happen. They should have passed that stimulus bill last week, not tomorrow. So I'm kind of rambling. The system's working. It will continue to work. We're considered essential employees. We have to be allowed to get to our offices. And I would say for anybody listening in, reach out to your bank, check their websites. If you're having your company or you personally are having some issues, contact them, talk to them, mortgage companies, so forth. Everybody that's in the financial services sector is expecting to assist those that are in need. As far as new business, to some of the other questions, it's very slow, as you can imagine. We're not seeing a whole lot. We're really working with our customers that maybe are facing some tougher times. 2 weeks from now, I'll know a lot more than I do today. Like I said last time, we had a whole year of buildup before we really felt the impact of it.
Thanks, Bill. I know, at least from what little I hear about the stimulus bill, banks are going to be crucial for small businesses to have access to capital, and you're going to be the distribution network. It sounds pretty clearly like. And
I think that needs to happen to get the funds out as quick as possible.
I know we've seen a lot of community banks go away in the wake of Dodd-Frank. I'm glad that we've got as many as we do left, and it's going to be a crucial time and demonstrate once again how important they are in their communities. Last but certainly not least, Heidi GANAHL, thanks very much for joining us. I know you had other commitments and had to get on just a little late, but welcome. I introduced you to the group before. You can certainly speak to this first question I've asked, and I'll run through it briefly for you. What's the last several weeks been like for you, your employees, your customer, your industry, revenue impact, market impact? Are you even open? I think I know the answer to that at the University of Colorado. Heidi is a regent there, and what I didn't mention earlier is that the University of Colorado operates on 4 campuses, if you didn't immediately know that. Almost 70,000 total students, 35,000 employees, about a $12 billion economic impact every year to the state of Colorado and beyond. So it's a big deal what happens at the University of Colorado. Heidi is our elected regent at large on that board. So Heidi, give us a quick and concise update as to the state of affairs over the last 4 or 5 weeks.
Well, thank you, Bob, and thanks, Katie, for having me on. I'm really excited about your campaign, and hopefully we can raise lots of money and get you across the finish line. We definitely need more women in Congress, but we need more Republican women in Congress. So as far as what's been happening in my world the last few weeks, it's kind of interesting. I'm an entrepreneur who has a startup business that launched last May around live events for young women across the country. And then I'm married to one of the top barbecue cooks in the state who has a couple restaurants, GQ Barbecue, one up north, one down south. And then I'm a regent. So I'm seeing it from the higher ed perspective. I'm seeing what's happening in the restaurant industry. And then I'm seeing what's happening in a tech company that I run. And the problems are all over the place. In higher ed, the issues are really more tactical, like how do we manage students that are here internationally that don't have anywhere to go? How do we take care of refunds? And how do we take care of graduation? That's more on the Boulder campus. Around CU Anschutz, it's incredibly complicated right now with all the research going on there and the doctors and the medical centers around the state and how we're managing that. And then you've got CU Denver, an urban campus where students, they don't have a lot of leeway to fiscally stay on board with getting their degree if they lose their jobs. And then you've got UCCS, which is challenging in itself down in Colorado Springs. We were already on a really tight budget on higher ed. We don't get a lot of funding from the state. So it's going to be a whole new world going forward. So we're doing almost daily calls navigating this. And our new president, Mark Kennedy, who Bob knows pretty well, who was a congressman years ago with you, Bob, has done a really fantastic job of navigating this. He talks a lot about the 4th Industrial Revolution and how the jobs of today won't exist in a couple decades. And so I think this is going to rapidly speed up our transition to going online for education and also to paying close attention to how our degrees tie to the workforce needs as we get through this and evolve. On the entrepreneur side and being the founder and CEO of a tech company now, we shifted all of our live events to virtual events within 2 weeks. We had to learn how to use Zoom really well, like the professional High Tootin' one. I have a young, really talented team, and they pulled off an event last night out of the blue that had 250 young women from around the country, and it worked flawlessly. Behind the scenes, it was crazy what was going on, but it took a lot of practice and a lot of figuring out and tinkering how to actually get people on and engaged. So we're going to try and shift that, but it's like creating a whole new business out of the blue. It's crazy. And then finally, the restaurant business. My husband says it best, I think, when he says, this is great that we're providing so much relief for employees and beefing up the unemployment side of things. But what the real complication is that they are being shut down by the government, their dining rooms are, and yet they're still paying full rent, and they're still being required to provide paid leave in some cases to employees and keep the employees on board with no revenue in the dining room. And I guess the question is, how do you make it equitable so that the landlords have to feel some pain while the dining rooms feel some pain, while the employees feel pain? And how does that play out? But it's something that's just it's going to decimate the restaurant industry. So I've been paying close attention to that. So I'm happy to answer questions about any of those three. I'm also the board chair for Job Creators Network, which is Bernie Marcus's foundation, the founder of Home Depot. And we're on the front lines in Washington, D.C., helping job creators, which is really advocating for small business owners around the country. And there's been some really interesting conversations going on the federal side, too, around how to help small business owners keep their employees and stay alive long enough to keep them employed long term.
Thank you, Heidi. Great information. I know that there's some questions out there. Some I think have already gotten into the system. Sean Bartley, can I ask you to maybe explain to everybody who may not know immediately how they ask a question? Can you let us know that?
Absolutely. If you have a question, raise your hand. There's a function along the bottom of the screen where you'll just hit the raise your hand function. We'll get you into the queue, get your topic, and get you involved in the conversation as we keep going along. So.
Perfect. All right, panelists, let's go to my second question, and maybe you've set the stage so well. I think maybe answers on this one can be a little more brief in thinking about the time we've got with our audience. Here's the question. I guess an obvious one. Have we hit bottom yet? Or is the worst still yet to come? Or do we know? How do we know? What might the next few weeks and months demand of you and your business before you reach the light at the end of this tunnel? What do you need from government, federal, state, local, until we can get well again? Let Dr. Olson, can I start with you again, because everybody's got healthcare on their mind.
Sure.
Give me your perspective.
Yeah, well, unfortunately, from my standpoint, the worst is yet to come. Like as I said, in our county, we just had our first positive, and that's going to rapidly change. The measures that we've taken so far with the social distancing and now the statewide mandate to stay home should help a lot. It'll tamp down the peak probably till May or June. But what it's done is it's prolonged the whole process. If nothing was done, we would have hit peak by mid-April, but that would have meant about 246 million Americans would be infected and about 2.2 million would die. So the procedures that we put in place will be effective in controlling that, and hopefully allowing us not to overrun our hospital system. And that remains to be seen. You know, we've got the 2-week mandate from President Trump, and we'll look and see what that looks like. But the problem with this kind of a virus and this kind of issue is that no matter what you do, no one has immunity yet, or we're starting to slowly get immunity, but this won't really be gone until we get a vaccine or a successful treatment. And once that happens, the game changes, and that's kind of the goal. But it's going to take some time to get there. And that I think from a medical standpoint, we're going to see little surges over the next 6 to 8 months that will have done a good job. Things have gotten better. We've gotten people back to work. They're cured or have immunity now, but there'll be little spikes along the way, and that's probably what we're going to see. And really, for my own situation, I'm kind of waiting with bated breath to see what the next couple of weeks show as this thing ramps up for us. As far as what the feds can do for us, from a critical access hospital standpoint, they really need to look at revenue cycle and cash flow for our facilities, because that will allow us to assist. We've already made arrangements with some of the hospitals in the metropolitan areas that when they have patients that are recovering or other patients that we have, if we have excess beds, that we'll take some of their overflow, and that'll be helpful for our bottom line, and also help them out with space. So there's a lot of things being thought of, and this is all done through the state at this juncture. And hopefully, the things that we've done will keep us from getting into too much trouble. But it looks like it's going to be a long haul for a while.
Hey, Bob, if I could interrupt, I've got a family member dealing with the virus. I need to go take a call, and I'll come back in.
Please, absolutely, Bill.
Okay, thank you.
Absolutely. Well, TJ, let me go to you. Part of this question is, have we hit bottom? Are we coming back? I think the doctor just addressed that in pretty absolute terms.
Sorry.
Sometimes the truth does hurt. TJ, what is your industry going to need to get well again from the federal government, state, local, wherever, before we can really say we're through this?
Well, it'll be interesting to see in other segments of our industry that are moving, non-perishable goods. I think they are seeing a tremendous slowdown. We have customers that service restaurants, as we heard about, and we're seeing huge reduction in volumes there. And so, I don't think we've hit bottom in terms of the impact, to Americans and to the economy. There's going to be more time that we're all going to spend, locked away, working from home to the extent we can. And for many Americans, that means that they are out of work, and it's going to just do tremendous damage to our economy, I think, as long as this goes on. But, as we heard from the doctor, and as we're hearing from medical experts, we don't have a ton of options. We can't go right back to work. We could see a greater medical risk. And so, I don't think that we're, anywhere close to where the bottom is on the impact to the economy. And again, thankfully, people still need to eat, and we're going to continue to provide that kind of service. With many of our customers like Walmart, Target, Rite Aid seeing huge demand increases, and those will likely continue as people are still locked away, increasing their personal inventories and staying away from restaurants.
Brad, we hear a lot about manufacturing jobs that were coming back to the States. I guess you didn't really go anywhere else. You started up here, but you're kind of one of our great manufacturing success stories. How about you from your personal perspective, but even broader about the manufacturing industry? How do we get through this, and what are you going to need? What's the industry going to need in the way of government support?
Bob, that's a good question. I do have part of my supply chain that continues to be based in China, actually. And so we get parts, we get other, completed units, things like that. I would point out 2 days ago in Hubei province, which is where Wuhan is, which is where this whole thing started, they lifted the lockdown. And so there is no more lockdown in Hubei province at this point. And so I feel like they have kind of crested, that peak, that hill. And certainly they're leveling off. They flattened that curve. They did lock down an entire province, similar to what we're, experiencing here in the United States with shelter-in-place orders, things like that. I think, I've had a number of conversations with, Katie's future colleagues in the Congress, and, everyone sincerely has their best intentions. I firmly believe this at heart. Had a lengthy conversation with Congressman Curtis the other day about what my business will continue to need and what I'm hearing from other businesses. And I obviously haven't seen the final draft because I don't think it's made it through the House yet, but I believe that government exists for moments exactly like this one that we're experiencing now. And so I'm optimistic that we will feel that support across all small, medium, and large businesses here in the United States to keep our doors open, to continue, growing and hiring. I'm still bullish on our economy. I think fundamentals are there. We just, it's like I read the analogy. It's like a hurricane that's going to last for 2 months all across the United States, And so if we look at it that way, I'm very bullish that we're going to be able to bounce back, that we're going to see the support that we're going to need, and that many companies like mine and like TJ's, will continue to try to find those opportunities to excel and grow, even in the face of really challenging economic times.
Glad to hear you put it that way. I tend to agree. I think when we do come back, and I don't know when that's going to be. Doctor, I think you framed it honestly. We just simply don't know yet, and in all likelihood, it's going to be a while. But when we do come back, I think it may be almost a vertical climb. I think we can come back with a vengeance and get well again. I certainly hope that's the case. But getting from here to there is going to be the important and critical part. Heidi, let me go to you next. And again, from your multiple perspectives, but especially from your perspective as regent, I mean, the state government in Colorado, I suppose Utah is quite similar. I just saw a number the other day that they're already expecting about $1 billion with a B, $1 billion hit to the state budget because of the shrinking economy here. And they're, every year over here, Utah is probably the same way. They go through a struggle of balancing the budget. Where the dollar is going to come from? And now they've got to deal with a dramatically reduced revenue stream. Federal government's going to be way beyond that. We've got expenses going up by the trillions, and revenue is going to be falling off precipitously. Universities aren't a lot different, Heidi. I know they've got budgets and they've got expenses. What's the discussion? What's your thoughts like relative to the University of Colorado and how other universities might be in similar circumstances?
Well, I think we've had good practice at CU because of the lack of state funding. So we've had to be very self-sufficient and rely on donors and offering great value to our students, whichever campus it is. So I think we're in not a good spot, but a better spot than a lot of other institutions around the country that do rely on a lot of federal and state funding. But I do think that this is going to just put the change in higher ed into hyperspeed. I mean, we've got to figure the online thing out very, very quickly, which I just had a call with a faculty member up at CU Boulder who ran into an ethical question about the online. Like, how do we grade if we know that the students are, if you're doing a closed book quiz, how do you deal with that if you know that they're not honoring that? So there's so many issues that are going to come up around this. But around funding, I think we've just got to continue to provide value and convince people that it's valuable to get an advanced degree and that we are a valuable partner in helping develop our workforce in Colorado, and really laser focus on those degrees that are going to make an impact and a difference in the next few years. And then just, rely on strong leadership and taking risks. We've got to take risks. We've got to try new things and not be afraid to fail, and teach our students that as well.
Dan Haley, same question to you and the critical oil and gas energy industry.
Yeah, I would say right now that our companies need to really focus on long-term market fundamentals and know that this is going to come back, know that oil and natural gas demand is going to continue to increase over the next several decades. That was predicted before all of this. And I think, as you noted, the economy coming back quickly, I think we're going to be a huge part of that as you go through that. Our country's going to need efficient, reliable, affordable, abundant energy sources in order for the economy to take off quickly. So we need to focus on that. We need to focus on how we can continue to produce, stay healthy, get our ledgers healthy. Liquidity is very important to our industry always, but especially now. So get those balance sheets healthy, figure out how we can continue to produce this product at a lower cost, cleaner, safer, better than anywhere in the world. I think we're starting to see some of that needed relief coming at the federal level. I think state and local governments can continue to be thinking about how they can be flexible when it comes to perhaps tax payments, penalties, with an eye toward keeping people employed, keeping jobs that we already have in the economy, in the marketplace, keeping those people employed. Here in Colorado, Weld County, Colorado produces 90% of the oil in our state. Yesterday, we saw those commissioners pass a measure that effectively it's a de facto deferral on taxes paid through October. And it's one of those steps that I think will mean a lot. It's meaningful to our operators who are being hit by Russia, who are being hit by Saudi Arabia, who are being hit by COVID-19. And it shows how we can partner with government in times like this to say that these jobs are important. This product is critical, as the governor is now saying. This product is critical and important to our state. So there are opportunities, I think, where we can work with those local governments, work with the state government, and find ways to continue to keep people employed and to understand that this product, oil and natural gas, are going to be. I mean, can you imagine being quarantined at home without power? Can you imagine running a hospital right now without efficient, affordable, abundant energy sources? This is a critical need, and so we need our state and local and federal government friends to understand that, to recognize it, and find ways to continue this supply and to continue the industry.
Thanks, Dan. Bill, welcome back, and I hope things are okay.
Thank you.
I think we're still on the same question. I think the doctor answered pretty clearly that we have not hit bottom yet. We've got considerable way to go, and we're not really even sure how far and how complicated that's going to be. But the big piece of this, I think, especially for you in the banking industry, financial industry, is the last part. What sort of assistance do you need? The bank's going to need, and then the banks being able to provide assistance to their clientele. What assistance? What's it look like from the government, federal, state, or local? And Dan just gave us a great example of how important local government flexibility can be.
I think the bigger issue will be assisting small business and consumers. I think banks are extremely strong right now. Not to be crass, but maybe the government's staying out of our way a little bit and letting us do what we need to do to help our communities. And as I mentioned earlier, they're acting more like partners this time. And they're even saying pretty much what I just said: do what you got to do to help out your communities. And you know what's going to be critical is 6 months later, there's not they want somebody to blame, and usually that starts with Congress and it rolls downhill. We need that. I think the other part is the government needs to tell us how we can get funds out, this 500 billion piece of the 2 trillion that's for small business, or whatever the number is. How we can distribute that money, it's got to happen tomorrow. It's got to happen today, and it's going too slow. And so we need to be the mechanism. I think we can more effectively be the mechanism than 800 SBA offices or any government entity, but they got to tell us how to do it, and they got to back us up on it, and they got to not criticize us because maybe we got a little bit creative after the fact. There's 5,500 banks now. There was 9,000 at the start of the last recession. Capital levels of banks are as much as 50% higher than they were then. There's not the loan concentrations we saw 10 years ago. Banks are strong. We don't need financial assistance to get through this. We just need support so that we can support the people that really need the money.
Great answer. Thank you very much. Katie, you're not going to be mayor of Greenville much longer. You're going to be in Congress next January. But maybe from your perspective, for the benefit of whoever succeeds you, what can you share with us?
You know, after listening to all the comments that I'm hearing here, I am optimistic for the future, because I think what we're seeing even right now is we are seeing things that we never thought were going to changing because of this circumstance, things that needed to change. And we're talking about regulations and government getting in the way, right? And so one of the things that I was very encouraged to see was the ability to allow doctors to practice anywhere in our nation, right? So regulations being waived that really don't make sense in this day and age. So I think that chaos creates opportunity, and we really are seeing a lot of that. And it, at least from my local level, what we did is we sat down and figured out, okay, what is the most essential thing that we need to be doing, and do that very, very well. And all those things that we were doing that weren't necessary gives you pause. And so as we go forward, I think that's happening in every city. I think that's happening in every county, and I think it's happening across the United States. And that is going to clear the way for new growth. It's going to clear the way for new partnerships. It's going to make it so that we can really talk about the fourth, did you say industrial revolution? Yeah. So yeah, that's the kind of thing that I'm excited about. I'm excited about the entrepreneurial and risk-taking spirit that we have in the United States. And I think that's going to, America is going to come together and show what we got. And I think that government is being helpful at this point, and let's clear out all the dead wood and get to work rebuilding the future that we want to see.
So necessity is still the mother of invention, huh?
Absolutely.
Works for me. Works for me.
Yeah.
John, do we have a question already? Or not yet?
We do. We had an anonymous question, and the question was, what positive change have you seen in your industry since the response to COVID-19 started that you think could be here to stay? And then for anybody else wanting to ask a question, you can use the raise your hand function or the Q&A function at the bottom of your screen.
And let me invite, because time's quickly getting short, and I had one more question I'd like to get into all the panelists too. Those of you, the 7 of you panel members that would like to take a stab at that question, go ahead, but you don't all have to feel obligated to do it. Who wants to go first?
I can speak up really quickly, and I'm not sure if this is going to be industry-wide. Up until 2 weeks ago, I did not have a remote work policy. We all showed up at the office every day. We, did our thing. And what's really interesting to me is I feel like I've actually been in closer communication with my colleagues at work than ever before, because even if somebody sat right outside my office, I'm now having to purposefully dial them up, and get them on video. So I actually think in my industry, my business, I think I'm learning something new every single day, and certainly, supporting people in any sort of a remote setting. I actually think this is going to be eye-opening for me and my team, because I think we're going to be able to hire people, that otherwise wouldn't be able to commute to my office every day and still have them be really successfully contributing to the overall well-being of my business.
Great answer. Anybody else want to take a shot at that?
If I could.
Go ahead, Mary.
Oh, I was going to say, so we have seen something similar as Brad has as city council and as senior staff in our city. Something exciting that we're doing now is that we are now able to have online city council meetings. It's going to look very much like this. We're going to have Zoom, and then our residents can join in. And I think that's actually really good for transparency and public participation if you can participate from home. So, and I think that's going to probably carry on. We'll see what happens, but it's one of the good things that's come from this.
Bill?
Bob, like Brad said, the learning how to work remotely, we knew that we had a business continuity plan that would work. It's been tested, but not at this level. So what this has done for us, God forbid there's something else happens a year or 2 or 5 years from now, I think everybody's going to be better prepared to implement a continuity plan that'll keep things functioning and maybe lessen some of the concerns that various industries have had that we've dealt with the last 2 weeks.
Anybody else? Well, Dr. Olson, I see your lips moving, but I think you were on mute.
Hey,
Oh,
Bob, I'm sorry. I'm getting a
gotta
lot of calls here. I need to go ahead and just step off, okay?
No,
I apologize for that, but
I'm on mute now.
our thoughts are with you, Bill. And
Okay, thank you.
Sean,
there you go, Doctor.
can you hear me?
Yep, hear you fine.
Can you hear me fine? Okay, I've lost video with you all. But from a medical standpoint, I think there'll be a paradigm shift in how we see patients, at least as an outpatient. I've talked about telemedicine and all that, and that's been slowly coming up for the last decade and a half. And there's been a lot of things that have hamstrung that to get, at least from my standpoint, out early. We've been trying to do telemedicine with consultants in the city for years, but there's been no reimbursement for it. And I think this will, with the experience that we'll have with this, and if the regulations don't go back to what they were before, we'll have a lot more outpatient medicine being performed via telemedicine or virtual medicine. And that'll be quite a feat, and it's going to be thrust on us rapidly, so that even old guys like me will be doing a lot of visits by my computer. So I think that we'll see that as a big shift in medicine.
I think you're right. I'm going to alter my third question just a little bit, and you don't all have to answer this, only those of you that care to. But an observation, I mean, we're in one of those very unusual times. We found ourselves in a very unusual time on 9/11/2001, certainly. We found ourselves in one of those stressful times with the financial crisis of 07 and 08. And after those things changed, they changed culturally. They also changed in our economic environment. We got things like the Patriot Act. We got the tax code altered. We got Dodd-Frank. We got Obamacare. Those of you that might want to opine, we've kind of been talking around this issue so far. Are we going to get more government? I mean, all those things I just mentioned, that's more government. I don't know that it was necessarily better government. That'd be another discussion. You can probably tell what I think about that. I don't think it was necessarily better government. But what's the outfall going to be from this? Are we going to make one of those giant leaps again with a whole lot more regulation, rules, and things we have to do to behave well? Or maybe is there a chance that government somehow gets the message that freedom actually works pretty good, and if they stay out of our faces, I think it was Bill Mitchell who mentioned it earlier, it'd be nice if they just left us alone a little bit. What do you think the outfall is going to be? And Doctor, I especially want to hear from you because healthcare is such a critical part of this whole equation.
Well, that's a good question. One thing we can be certain of, people will be washing their hands more. But I think from a standpoint of government regulation in healthcare, if this frees us up and allows us to function without so many regulations and rules that have kind of kept us from being reimbursed adequately for a long time now, I think that'll be of benefit. I'm not sure that will happen, but certainly would be, just being able to get paid for what you do would be helpful. I think from people as a whole, I think people be more mindful of 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 information that's given to them by experts like CDC, et cetera, and will take heed and maybe pay attention to the recommendations more willingly than maybe we have with this rollout. Although I think in the end, after this is all said and done, we'll all, as Americans, take pride in how we've all pulled together to deal with this, and how we've been able to weather yet another crisis in this country. So I'm looking forward to this just helping the system as opposed to hurting the system. And hopefully we'll see that happen.
I'm with you. Thanks, Doctor. Anybody else want to take a shot at that? Dan, I see you're kind of anxious.
Yeah, not anxious, but I was just going to say that I think how we live and how we work will change greatly in the coming months. We're going to see obviously those things like, just working from home work and those certain telecommuting things. I think that shaking hands is something that will probably go away. That is, you grow up in the West, a handshake means something, and that's something that's going to take me a little while to get used to. I think government will get bigger, and probably necessarily in the near term. When that happens, I think you see your personal freedoms shrink, and I don't think that's good for us as Americans in the long run. So I hope that when we get through this and we get to the other side, we can begin to focus on what really matters and stop sniping at each other over things that are really kind of pointless and partisan, that we can find ways to work together, to work across the aisle, where you see Republicans and Democrats coming together to do what's right for this country, what's right for the people who live in this country. And that maybe a few more Americans will be like Mayor Witt and decide that they want to get more involved in our civic life, to get more involved in the political life, to know that those who failed us along the way are held accountable for these things, and that we can begin to really invest back in our civic life in this country. Because you see, when something like this happens, how we're all intertwined, how government and civic life and business and industry are all intertwined, and they're all necessary parts of our American fabric of our society. And we just need to get back to, I hope we can get back to those days after 9/11 and have them last a little bit longer than they did last time, where we're all trying to do what we think is best for America, and not looking at our party affiliations, and really just looking at the fact that we're all Americans. We need to move forward together.
Well, I like that. I share your hope and your vision on that, Dan. Thank you very much. If it's all right with the panelists, I know we've got a number of questions in queue, and in the time we've got remaining, I'd like to be able to answer at least a few of those, if we can. Sean, have you got something teed up?
Yeah, you got one more here, and it's a question for Katie. It's the question is, what is it that you see that'll make a difference with your governing philosophy once you go to Washington, given what's being talked about now? Like what's possible because you are willing to jump out there and serve.
Yeah, thank you. Well, when the three things that I'm running on are preserving freedom, expanding opportunity, and reigniting patriotism. And a lot of that we've been talking about through this whole hour. And so my philosophy is that we need to get government out of the way as much as possible. I think that over the years, it's become overgrown, and it's hindering our business instead of helping. And we need to, as I mentioned before, we need to clear the path. And that's going to be my job, is to get through there. And how can we expand opportunity? How can we get rid of some of these regulations that don't make sense? I have a real soft spot in my heart, especially for our oil and gas people and the environmental extremists who make it very difficult for them to do the job that we all rely on them to do. So that's what I'm going to bring to this, is an effort to decrease the unnecessary regulations. Obviously, we need some but I think that it's become a thicket out there. And so let's see what we can do. And I think that we are in a period of opportunity right now. We're seeing what doesn't work anymore. And so things are becoming very obvious what doesn't work. So let's get in there and clear it out.
I think our hour and a half is just about expired, and I was worried that we may not get to everything that we would like to be able to do, but I think we've had a tremendous discussion. Let me thank the panelists. Let me thank all of the attendees that have been part of this. And I'm sure if you had a question you didn't get answered, I'll bet if you get it Katie's direction, I'll bet she'll get you an answer. And the same for any of the panelists. If you're dying to talk to one of these, we'll forward that on. Let me again thank Heidi and Brad, Dan, PJ, Dr. Olson, Bill Mitchell, who's now moved on, but especially Katie for having the idea to make this even happen. This is a tremendous opportunity, and I haven't been in politics for more than just a little while and been part of a whole lot of different fundraising efforts to communicate with people. I think this is the best one I have ever come across. This isn't the standard stump speech. I hope the attendees agree with me that thanks to these panelists, we've managed, and your vision, we've managed to share information and really make this a quality briefing, not just another write me a check and thank you very much, kind of a political event. So congratulations to you, Katie, and let me ask if you've got any final words you'd like to share, and then we'll sign off.
Absolutely. And I am so excited to be able to be associated with these panelists, and thank you for sharing your expertise and sharing your behind the curtain view of what's going on in your industry. I am very excited to be able to serve my people, serve my district, serve my nation, and I am looking forward to serving with President Trump and Congress to make sure that we keep on growing our economy, making America great again. I think that we are going to, I am bullish on our economy because I do think I see the entrepreneurial spirit rising up. And so I'm excited to see what happens next and working shoulder to shoulder with good people all across this nation to make sure that that happens. So thank you again for participating. Thank you for Bob. You're the master. Thank you so much for sharing your expertise and managing all these different voices, but appreciate your time.
It's been a pleasure, very much a pleasure. And I want to be able to say I knew you win, so go win. John, anything we need to share, or are we good to go?
Just last thoughts. If anybody has any questions they didn't get answered, Katie would love to have you email her directly, katie@katiewitt.com, or visit our website, katiewitt.com, to get more connected with the campaign and the conversation. We're also on Facebook at Katie Witt for Congress. So all the ways to get connected there. And we look forward to having more of these conversations with people in the days and weeks and months ahead.
Been terrific. Thank you all very much.
Thank
Have a
you,
great
guys.
Thanks, everyone.
Appreciate it.
Thank you for joining us for the coronavirus briefing. There are many ways to get involved with our campaign. Share this briefing with like-minded conservatives. Sign up for our upcoming virtual cottage meetings. Donate to our movement. Come join us today and be a pioneer and a patriot with us.